Inflammatory bowel disease, or IBD, is another cause of rectal bleeding. This term encompasses conditions like Crohn's disease and ulcerative colitis, both of which cause chronic inflammation of the gastrointestinal tract. In ulcerative colitis, the inflammation is usually limited to the rectum and the colon, leading to frequent episodes of bloody diarrhea, abdominal pain, and urgency to have a bowel movement. The blood can be mixed with mucus, but since it is in the colon and therefore has limited length to travel before it exits out the body, it is typically bright red in color. Crohn's disease, on the other hand, can affect any part of the digestive tract, from mouth to anus, with 80% of the patients having small intestine involvement, especially the distal part of the small intestine known as the ileum. Bleeding in Crohn's disease is often less common, but it can still occur, especially if it is affecting the colon, with 50% of the patients not just having their small intestine affected, but also having the colon affected as well. Now, although either one of these inflammatory bowel diseases could lead to life-threatening complications, this is pretty rare. However, they definitely are life-changing as they can greatly affect a person's day-to-day life. Managing IBD typically requires medical intervention, meaning the use of specific medications, and sometimes even surgery, where a surgeon would remove part of the damaged portion of the digestive tract. Now, with this next one, I actually want to start with the color. Some people can have black, tarry-looking stools, and this is referred to as melena. This color is an indicator that the bleed is much more proximal in the digestive tract, like in the stomach or the very beginning of that small intestine. Now, this is often due to things like gastritis or inflammation of the stomach or erosions of the lining of the stomach. And let me show you this other dissection right here. This is the inside of another stomach here, and this is called the tunica mucosa. So like an erosion or a deeper erosion would be referred to as an ulcer. Now, there is variability on how serious this can be. Like if an ulcer were to get bad enough and perforate the stomach, that can cause life-threatening complications. But most of the time, these stomach conditions can be managed before these serious complications arise. And finally, we need to discuss colorectal polyps and colorectal cancer, which is one of the more serious causes of rectal bleeding. And this is important because colon cancer is one of the most commonly occurring cancers and causes of cancer death. Now, polyps are small growths on the inside lining of the colon and or rectum. And while most polyps are benign, some can develop into cancer over time. Bleeding from polyps or colorectal cancer might be less obvious, sometimes presenting as what we refer to as occult blood, which is blood that you can't see with the naked eye, but can be detected with certain stool tests. In some cases, bleeding from colorectal cancer might be more noticeable, appearing as dark red or maroon blood mixed with the stool. Other symptoms of colorectal cancer can include changes in bowel habits, unexplained weight loss, and abdominal discomfort. But because the symptoms are not quite as obvious, this is why regular screening, like colonoscopies, is crucial for early detection and prevention of colorectal cancer. Because the earlier you catch it, the less likely it is to spread to other body regions. And when cancer cells spread to other body regions, this is known as metastasis. Now, we are actually pretty good at treating colon cancer if we catch it before it has metastasized. And with our lab, one of our bodies that we have shown in many of our videos actually died of colorectal cancer that metastasized to the liver. And once it spread to the liver, it made it very difficult to treat and ultimately led to the death of this body. So early detection cannot be stressed enough when it comes to cancer screening. And as far as the cancer screening guidelines for colon cancer, I'll put a link down in the description if you want to check some of those out, where it goes into age and certain risk factors and when you should begin this screening process. Thanks for watching today's video, everyone. And I do want to say that we didn't cover every potential cause for rectal bleeding. So if you have any questions or topic requests, put those in the comments below. And again, thank you for supporting our channel. If you want to watch some other videos on the digestive system, like how much food the stomach can hold or what happens when you swallow gum, we'll link those here. And of course, we'll see you in the next video.